I've heard of skin cancer, but I don't think it affects me. I don't think it affects me at this time of my life. I think that skin cancer is a rare condition that happens to maybe like very few people, maybe because of the genetics or whatever. My name is Nicholas Huynh. I'm a 14-year-old high school freshman, and I participate in cross country as well as long distance running. When I first started running, I just wanted to improve my health, improve my stamina for other sports I might play in the future. So that really helped. I started out with this running program at my school where you train to run the marathon. So I've done 1 year of that. I'm doing another year in my freshman year of high school. But running long distance led to joining cross country, and I think it was really great participating in a school sport for the first time. Sometimes I see or I hear my coach say stuff about wearing your sunscreen when you go practice, both on your own and with a team. Sometimes I do see runners go without it. I personally go without it as well.
My name is Elisa Mackey. I'm 58 years old, and I'm a high school math teacher and a high school tennis coach. High school is a critical age to worry about sun protection. I don't know if it's just high school. I think kids in general need to start focusing on sun protection because their skin is it's new. It's fragile. I mean, the earlier you start protecting your skin, the better, and you won't have the damage that just kind of builds up over time. When I was younger, my skincare routine was to put baby oil on my face, and that was almost daily because I mean I've always had kind of a baby face. Up until I was probably in my late 30s, I had like a kind of a youngish looking face. And the baby oil just gave it like a nice glow. But I feel like the baby oil in general in the sun was probably the worst thing that I could have done. But I didn't start feeling the effects or seeing the effects of it until I was probably in my 40s. So my skincare routine when I was younger was pretty much non-existent.
My name is Rihanna Garcia. I'm 17 years old and I'm currently a junior in high school right now. In my morning routines, I usually wake up and then start washing my face and put lotion on, and then I begin putting on like some concealer, some foundation, and then curl my lashes just to like make myself look good for school. But it doesn't occur to me to like, oh, I should put on sunblock before any of this. It's just sort of like, I only put that on when like I need to go to the beach or something, because it's not like, oh, being in the sun at school is gonna affect me. It's just sort of like, I'll be fine.
I am Lisa Thomas, and I am a tennis coach and the CEO and founder of Move Your Feet Tennis. Sun protection is very important. I always ask my students when they get here if they put on sunscreen, and make sure they put it on before we start our practices, especially my younger kids, because they'll just run out without it, so I make sure they put on sunscreen. Yeah, it's very important. For me, as an African American, I think early on I didn't think that it was that important because I didn't think that African Americans got sunburned. And then I got sunburned. And so now I always put on sunscreen. Yeah, I mean, I have a lot of sun exposure. I'm outside all the time. While I was still doing research, I was generally only outside in the evenings, but now that I'm doing coaching full time, I'm outside all the time. So I'm very conscious about not just protecting my skin, but protecting my eyes. So yeah, I'm very, very careful about my exposure. I would talk to my students about really using sunscreen and being careful. I mean, they've got to take care of themselves early in life so that they're going to be exposed to the sun for many, many years. And so they've got to take care of their skin, their bodies over time.
My name is Gabby Shao. I'm a senior in high school, and next year I'm going to be playing D3 tennis at Amherst College. So I started with Coach Lisa when I was 5 years old, and it's been almost 13 years with her. And I really love the game, and I started training more seriously in my freshman year in order to play college. And so I played like tournaments every weekend and like practiced like many hours. Let's just go with many hours. I put sunscreen on before every practice unless there's no sun out. And then if it's like during the summer, I'll reapply like twice because we practice for like 5 hours. And then for a tournament, I'll do it before every single match, just to like make sure everyone's sun protected.
My name is Anthony Wong. I'm a skin cancer surgeon on Long Island, New York. I have a clinic in a practice called Bella Ray Dermatology. I remove different types of skin cancers. So patients are referred to me by dermatologists in the area, and they come to me for these special surgeries to remove their skin cancers. I think patient education is key because it's up to the patient to try to protect themselves when they're younger, when they're not seeing doctors, to prevent the sun damage so they don't get the skin cancers later. However, I kind of want to re-educate patients, again, having them not rely on sunblocks too much as the sole protective device to block them from getting sun damage. I like to tell them that the sunblocks only help a certain percentage of the harmful rays from damaging your skin, but it's usually clothing, hats, staying in the shade that are better than sunblock. So I try to re-educate them because a lot of people still think that the sunblock on the skin is the most important thing, but I kind of re-educate them by telling them it's only a small percentage that the harmful rays is going to be blocked by sunblock.
My name is Jack Wright. I'm a former high school and college counselor, 88 years old, and I'm a skin cancer survivor. Before my diagnosis, I was pretty naive about the consequences of growing up on a farm in western Kansas, driving tractors and working in the fields. It was the mentality of young teenagers back in my day to have a good suntan. It was macho to have a good suntan. And so I would drive a tractor, 8, 10, 12 hours a day without a shirt on, and with maybe just a baseball cap for a hat. You could put up your own umbrella on the fender of a tractor and have some shade, but it's more macho to have that suntan. So I grew up completely unaware of the dangers of overexposure of the sun.
Social media like TikTok and Instagram, it really puts like these tanning oils and like all this like tanning stuff on a pedestal compared to like sunblock. Lots of products that are advertised that have SPF only go up to about 15 when in reality like the daily recommended amount should be over 30 because that's like the only amount that will really keep you safe, and 15 doesn't really amount to anything in the long run. I see a lot more content promoting tanning, especially using these like popular actors or singers like, oh, look it, I use this. And it makes that more important than using SPF or like sunblock because I guess it enhances your appearance more than like sunblock does.
I think people my age don't think about sun protection because they're younger and they don't think about the long-term effects.
What worries me the most about if students don't change their habits is, developing cancer. We could have like almost like an epidemic of skin cancer if people don't change their ways, if they don't change their skincare habits. The girls on the tennis team always put on sunblock before they get on the court. They're pretty good about doing that every single time, and they don't apply just a thin layer. It seems that they apply a lot on, because it takes so long for them to get it done.
One thing I wish I knew about skin cancer before is how common it is, right? Everybody spends at least a little bit of time out in the sun, and skin cancer can really affect them, even if the effects don't show up immediately.
A lot of people I know have had sunburns. I mean, myself personally, like I said, I was always in the sun. I love the beach, and the first time I went to Hawaii, I actually got really sunburned, and I'd never been sunburned before. And it was painful, and my skin peeled. And so after that, it changed my whole view on you know, how sun can damage everybody's skin.
Teaching students has changed the way I think about sun protection, because I'm out in the sun a lot for hours in the middle of the day with my tennis team, and I've had to cover up, because I notice that the older I get, the easier I burn now, especially if the sun is just on one side like it is right now. I burn a lot easier now. So I bought some of those floppy hats. I bought long sleeve shirts. I got them, and the zinc sunblock. So yeah, it's changed it a lot. Wearing sunblock is a good first start, but I feel like your skin is still exposed. So wearing an extra layer, long sleeves, a hat, these are some things that I'm taking pretty seriously.
I know that in my family, skin cancer is a problem that runs very deep, being that it affected my grandfather, and it's sort of the reason why I'm sort of not here with us anymore. And I know my dad is very worried about it, and he's very concerned about his skin. Like when he sees like a small spot that wasn't there before, he freaks out a lot more than any like normal person would. My family's history sort of like encouraged me and pushed me to learn more about skin cancer and like its causes and like how to spot it, and I guess like its severity, especially since it's like a problem that runs in my family. And because of that, it inspired me to like be a part of this and like learn more and not be so like blind to it like a lot of people are.
Ever since I came to California in 1960 with my wife, and started teaching and counseling, we belonged to the Kaiser Health Facility, and they encourage their members to have a physical exam every 6 months. And so it was the doctor that gave me a physical and made a referral to another department that had something to do with treating skin cancer, cosmetology. And so it was at that point I first become aware that these little patches of dark skin on my ears and my face and my arms were more than just a suntan. They were skin that was irritated and growing in an irregular way, because it was not outright cancer, but it was cancerous. And so it was in the early 60s that I became aware that I had all these little growths on my upper body. The hardest part was being embarrassed by how ugly my face was when they operated and removed all that area of skin about the size of a baseball in diameter. And so this process went on for several days, over a period of a couple of weeks of doing the surgery. And when the surgeon was removing the cancerous growth, she started in a little spot about the size of a quarter here on my face. And then she'd take a sample and leave the room and go into a lab and test it to see if it was positive or negative with the cancer growth. She'd come back and say, well, I got to take a little more. So she'd do a bigger circle, take a sample over, come back. Well, I'm sorry, but I got to take a bigger sample. And it kept going and growing in the diameter, as you saw the picture, before she finally came back in and said, okay, we've got it all. This last sample of skin that we took over was negative, and so we don't have to remove any more of your face. But I'm laying there on this table for several hours that day, wondering when is this going to end, you know.
They always have to have hope, and they should have hope, because a lot of the new treatments are miraculous in tackling these aggressive skin cancers. So we never let them lose hope, and we always reassure them that we'll always be here to help them, and that we'll do everything we can. And a lot of people are okay when they have these aggressive skin cancers. I would say my average skin cancer patient is between 60 and 105. And most of them are very fair. And most of them will say, oh, when I was a kid, my parents used to, put me outside to play without any sunblock, because no one knew about sunblock, which is totally true. Everyone just played outside and didn't wear anything back then. And then you have your lifeguards, your clammers and roofers and all those people that have hobbies and occupational hazards that expose them to the sun. And then you have the subset of younger people that go to tanning salons, which is quite bad. A lot of the young people that come in with these serious skin cancers like melanomas, I would say many of them have had a history of going to tanning salons and getting tanned repeatedly, and then they eventually can put themselves at much greater risk of developing skin cancers.
I think that athletes of color used to kind of take that for granted because they thought, the melanin in their skin protected them from sun damage. I think everyone knows that everyone can suffer from sun damage. So I think everyone is much more conscious and protective of their skin now. I think living here in California, everybody is about getting a tan. And even myself, even I used to go to the beach and want to get a tan. And as I said, getting sunburned changed my whole view of that. And yes, darkening of the skin, laying out in the sun, trying to get a tan is the worst thing you can do. It causes so much damage, and you don't see that damage right away. But like I said, as you get older, you start to see visible sun damage to your skin. And so, yeah, tanning is not a good thing.
I would say you should reapply when you think the sunscreen is not on your skin anymore. So I like sunblocks that have a little tint of white, like zinc oxide in it or titanium dioxide. You could be going swimming for the whole 2 hours and everything will be washed off. So if you see your skin is not as white, it doesn't have that sheen anymore, then you should reapply.
I think that since schools really don't teach about skin cancer, I think it's important for everybody to do their own research. Being a part of this documentary encouraged me to go out, do my own research, and really see the effects of skin cancer and how common it could be. I found it surprising that the sun, even though it's so far away, the radiation it can really affect you. Even so, sunscreen can really protect you from it. I think if you're running outside for long periods of time, it means that you're exposed to the sun a lot, and that means more radiation is hitting your skin. So it would definitely affect you more in the long term. I'll definitely be more careful, wear a hat, wear my sunscreen all the time when I'm going outside, even when it's cloudy, because the radiation still goes through the clouds.
I wish to have known when I was a young teenager that overexposure to the sun has consequences. As I said before, growing up with a suntan was a macho thing for boys to do, to have a big tan and be muscled, and you could only get a good suntan if you did not wear a shirt, did not even wear a t-shirt, wear a small cap, if anything, to get exposure to the sun, so you would have a nice suntan on your body. Today, I think the awareness has switched 180 degrees, that people are aware of the dangers of overexposure.
I think the world is changing a lot. In the past, people really felt that being tan was a sign of being healthy, having the time to go on vacation and being happy. But now I think the world is changing a little bit. I see more and more people kind of following like the Asian method, like Koreans, Japanese, Chinese, any of the populations in Asia, they value being fair. They like being fair because they think it's healthier. They think it means like you're actually not working out in the fields and you have a better job. So socially, being fair in Asia is like looked upon as being good. So I think a lot of people here are kind of noticing that with like K-pop and K-drama and all that stuff. People are very fair and actually like very white looking, almost unnaturally fair. And I think it's becoming more acceptable. So being tan isn't necessarily, the thing that you should strive towards to, look good, to feel good. Hopefully people will realize that being fair is not bad and it's actually good for your skin and will lessen your chances of getting skin cancer.
After doing more research on skin cancer and the sun's radiation, I feel that I should apply sunscreen, reapply sunscreen, and maybe carry a little sunscreen bottle when I go on for very long runs. I think me being in this documentary really means that I got to reach some more people who are in my generation who really don't think about sunscreen as I once did, and probably make them try and improve their habits. That will definitely affect them in the future.